Infection control is a cornerstone of quality care in any healthcare setting. For certified nursing assistants, CNAs, proper handling of linens, sharps, and waste is critical to prevent the spread of infections and protect both patients and healthcare workers. Mismanagement of these materials can lead to contamination, injury, and transmission of harmful pathogens. Why proper linen handling matters. Linens such as sheets, blankets, gowns, and towels can harbor infectious microorganisms, including bacteria, viruses, and fungi, especially if they are contaminated with blood, body fluids, or secretions. If handled improperly, soiled linens can cause cross-contamination, leading to healthcare-associated infections, HAIs. Principles of safe linen handling. First, always wear gloves when handling soiled linens to protect your hands from contamination. Be sure to change gloves between rooms and immediately after handling contaminated materials. Next, avoid shaking linens, since this can release infectious particles into the air and increase the risk of airborne transmission. Instead, handle linens gently and fold them inward to contain contaminants. In addition, use laundry bags properly by placing soiled linens directly into designated laundry bags or hampers without touching the outside of the bag. Remember, bags should be leak-proof and labeled appropriately. Furthermore, always separate soiled and clean linens. Never place clean linens on contaminated surfaces, and store clean linens in a clean, dry area away from soiled items. Finally, after removing gloves, perform proper hand hygiene to prevent the spread of microorganisms. Practical steps for changing bed linens. To begin, inform the resident and explain the procedure to maintain their dignity and cooperation. Then, gather all necessary supplies before starting. As you proceed, remove linens carefully, rolling them away from your body and placing them in the laundry bag. Afterward, inspect the mattress for any contamination or damage. Next, place clean linens on the bed without contaminating them. Lastly, avoid contact between clean linens and floors or other contaminated surfaces. In summary, proper linen handling is more than just tidiness. It's a critical step in infection control. By following safe practices and transitions from dirty to clean procedures carefully, CNAs help maintain a safer and healthier environment for both residents and staff. Understanding safe handling practices is essential to prevent injuries and protect both staff and residents. Sharps include needles, scalpels, broken glass, and other objects capable of puncturing or cutting the skin. Because of their nature, they pose a significant risk for both injury and the transmission of bloodborne pathogens such as HIV, hepatitis B, and hepatitis C. Safe practices for handling sharps. First, never recap needles, since recapping greatly increases the risk of accidental needle sticks. Instead, dispose of needles immediately after use. Next, always use sharps containers. These designated, puncture-resistant containers should be located as close as possible to the point of use for safe disposal. In addition, do not overfill containers. They should be replaced once they are 3/4 full to prevent injury during disposal. Furthermore, avoid hand-to-hand passing. Use a neutral zone or place sharps on a tray to prevent accidents when transferring them. Finally, if a needle stick or sharps injury occurs, report it immediately and follow your facility's post-exposure protocols without delay. In short, proper sharps handling is all about prevention. By following safe disposal practices and avoiding risky behaviors, CNAs protect not only themselves, but also coworkers and residents from potentially life-threatening infections. Although CNAs do not typically perform injections or handle sharps directly, they may be responsible for cleaning up or transporting sharps containers. CNAs should never handle sharps without proper training and always follow facility protocols. In healthcare, waste is more than just trash. It can carry infectious agents, hazardous chemicals, and sharp objects that pose serious health risks. It's important to understand the different types of waste and the proper procedures for handling them safely. Types of waste in healthcare. General waste. Non-infectious waste, such as paper towels, packaging, and food waste. Infectious waste. Biohazardous waste. Materials contaminated with blood or body fluids, such as gloves, dressings, and certain linens. Sharps waste. Needles, scalpels, and other items capable of causing injury. Hazardous chemical waste includes pharmaceuticals and toxic substances. Proper waste handling procedures. First, always use designated containers. Place infectious waste in biohazard bags, sharps in puncture-proof containers, and general trash in regular bins. Next, seal and label biohazard bags with the proper symbol before removal. In addition, avoid overfilling containers to reduce the risk of spills or accidental exposure. Furthermore, always wear gloves and required PPE when handling waste. Finally, follow your facility's protocols and regulatory guidelines, which may include specialized handling and transport procedures. Environmental and safety considerations. Proper waste segregation not only prevents infections, but also protects sanitation workers and the environment from hazardous exposure. Never dispose of sharps or biohazard waste in regular trash bins, and always be familiar with your facility's emergency procedures in case of spills or contamination. In short, handling waste correctly is about more than cleanliness. It's about safety. By knowing how to separate, contain, and dispose of waste properly, CNAs help prevent infections, protect others, and keep the healthcare environment safe. Proper handling of linens, sharps, and waste is essential in maintaining a safe healthcare environment and preventing the spread of infection. CNAs play a vital role in infection control by applying correct procedures and being vigilant in their duties. Mastery of these practices not only safeguards residents and staff, but also fulfills critical standards tested in the CNA exam. Consistent attention to detail, use of PPE, and adherence to protocols will empower CNAs to deliver safe, quality care while protecting themselves and others from harm.